today's episode of Lifeline, let us talk about HIV and AIDS and battle the stigma with information. Join us in building a society where life, love, and hope prosper. I am Angelique Luna, your host for today's episode of Lifeline, where we improve our lives by feeding our minds. Together with us today is Dr. Cristel Jane Medina, a distinguished fellow of internal medicine and a diplomat of infectious diseases specializing in the diagnosis and management of complex systemic infections.
Hi. Hello. Good day.
Good day po. Kamusta naman po ang day niyo so far?
Okay naman. Medyo mainit sa labas.
Ayun, nandito na po kayo. Is it your first time po here sa Lifeline?
Yes, it is.
Po, okay. With that, we'd like to start off with some general questions po. So, for my first question po sa inyo, Doktora, with the number of HIV cases increasing in the country, what are the general facts that we should know about HIV and AIDS?
So, actually, that's a very good question. So, one of the things that I have to emphasize when it comes to different infections is that we have to know the pathomechanism of the different disease so that we know how to prevent them. So from the name itself, when we speak of HIV, it stands for Human Immunodeficiency Virus. So in short, isa tong virus na nakakaapekto ng tao. Ang pathomechanism niya is that it weakens, pinapahina niya ang depensa mo. So, if we are going to talk about ano ba muna yung normal sa isang tao, ano ba muna yung normal na depensa. So, in a normal scenario, we are created by God in such a way na meron tayong own soldiers. So, katulad ng mga usual police natin sa kapaligiran, may sarili-sarili yan rango, may sarili-sarili yang responsibilidad. In HIV, we have this specific soldiers called the CD4 cells. So, the normal number of CD4 cells is around 500 to 1,000. The downside is that in HIV patients, it attacks the CD4. So, kapag inatake niya yung CD4, mapapababa niya yung number. The main responsibility of your CD4 is to protect you against opportunistic infection. So kapag sinabi nating opportunistang infection, kumbaga sa isang tingin, ang mga mikrobyo is para minsan wala silang pwedeng ibigay na infection. However, kapag ikaw ay naging immunocompromised na, that's the time that they will take advantage. That's why it's called opportunistic infection. So the lower the CD4 count, that's the time na aatake na or magkakaroon na ng symptoms ang isang pasyente. So that is how HIV works. So yun ang general parang pathomechanism of HIV. Now, I have to emphasize as well that HIV is different from AIDS, or technically HIV kasi is a spectrum. So you have stage 1 up until the stage 4. So may ibang tao na iniisip kapag HIV ka, AIDS ka agad. Not all HIV patient have AIDS. Pag AIDS, ito na yung pinakahuli doon sa mga stages natin wherein sobrang depressed na ng immune system. And lahat ng klaseng opportunistang infection, even if normal lang siya or normal flora lang siya ng katawan, sometimes it can take advantage and produce infection. So that is the basics of HIV.
And with that po, no, Doktora, what are the signs or symptoms po of HIV and AIDS that an individual should look out for, no, para sa early detection?
There are some people with no symptoms. Lalo pa kunwari ito ay makikita mo during the early part of the disease. Sometimes they will present to you asymptomatically, walang symptom. May mga patients ako na sila ay nagpapa-clearance lang dahil sila ay pupunta ng ibang bansa, sasakay ng barko. Sometimes kasama doon ng screening, and even if wala silang symptoms, they would present with positive tests. So, yun ang number 1 na kailangan kong i-emphasize. There are some patients, there are some people with no symptom. Kailangan alam mo lang yung risk factor mo. Alam mo kung ano yung mga naging activities mo in the past that predispose you to having HIV. Now, on the other hand, if you already have HIV, kapag ang isang pasyente ay na nagkaroon na ng symptoms, ang most common sa kanila is hingal, Most especially kapag ang CD4 count is less than 200, 'di ba? Sabi ko dapat 1,000 siya, 500 hanggang 1,000. If the CD4 count is less than 200, the most presenting symptom would be dyspnea or parang hinahapo ang isang tao kasi ang most common pathogen would be affecting the lungs. It's either magkaroon ng tuberculosis or pneumocystis na tinatawag namin. The lower the CD4 count, mas marami pang mga mikrobyo yung pwedeng mag-take advantage. They can present with diarrhea, worst case scenario, they can have wasting, mga malnutrition sa pasyente.
What are the medications naman po available and needed to treat HIV and AIDS po?
Okay. In HIV, we have what we call ARTs or ARVs. It stands for antiretroviral therapy. So, ang i-emphasize ko dito kapag ikaw ay nakitang positibo for HIV, maraming mga institusyon na may mga clinics for HIV, ang gamot dito ay libre. So, yun yung tawag namin doon. It's a combination of your antiviral, usually 2 to 3 medication in combination just to combat HIV. So, lahat yan ng HIV clinic, libre yan because that is subsidized by the government. So, sinasabi ko lang din yun, in-emphasize ko lang din siya para at least malaman ng mga tao na merong way out for them to be treated with the infection po.
Kumbaga open po talaga, no? And with that po, Doktora, what proactive measures naman po can an individual take to protect themselves and others from HIV?
For this one, I think number one is proper education talaga. Yun yung number one in all kinds of diseases, may it be infectious diseases or ano man na non-infectious disease, ang basic of all the management or backbone of all the management would be education. Kasi if they know the pathomechanism of the disease, it will push people to na magpa-check up at magpagamot. So yun yung number one pa rin for me. Second is that syempre, when we speak of HIV, one of the main modes for it to be acquired is through sexual contact or bodily fluid, in contact with bodily fluids. So, syempre bilang we are in a Catholic university and we believe in our religion, we have to practice din monogamy. Of course, it's one of the isa yun sa mga ina-advise namin sa mga pasyente. As much as possible, we have to practice monogamy. On the other hand, if let's say they know they already have the risk, so since alam na nila yung risk nila, they have to subject themselves to screening, to testing. Sila na mismo yung mag-initiate sa sarili nilang magpa-test. So, kadalasan ina-advise namin yan sila magpa-test every 3 months, especially if they know they have the risk, subject themselves to the screening every 3 months. Likewise, ang HIV kasi is a blood-borne pathogen. So, aside sa mga usual na kunwari sexual contact, isa pang pamamaraan para makuha mo yun is in other people who share needles. Let's say there are certain individuals who uses different drugs and they share needles sa isa't isa. So, being a blood-borne pathogen, it is one of the means para makuha siya. So, we have to advocate na they shouldn't do that or let's say no sharing of needles.
With that naman po, Doktora, in what ways does increased awareness address the physical, mental, and economic burdens po of HIV?
Actually, ito isa sa mga pinakamagandang question kasi alam naman nating lahat na HIV is still, even if a lot of people are already aware of HIV, it is still a taboo for some. So, kung meron mang isa sa mga nararanasan talaga ng mga HIV individuals, yun yung mental burden for them. So, I do believe na yung mga simpleng lay fora like this one and yung mga different, mga advocacies in different institution by simply making people aware or educating people about HIV, malaking bagay siya kasi, kunwari, magbibigay ako ng example. Let's say, meron akong pasyente na pag-isa lang siyang pupunta sa akin sa clinic and alam natin na siya is positibo with HIV. Ang unang-unang parating tanong ko sa kanila is, ano ang nararamdaman mo? That's always my first question. And meron ka bang sinabihan? Yun ang next question ko sa kanila kasi most of them, they will tell me wala akong sinabihan. When in fact, it's very burdensome for them na mag-battle nung disease na sila lang. So kaya sometimes if mag-isa lang sila, we encourage them to join. There are different social groups, there are different support groups for HIV, and different clinics meron ganun. So once kasi sila is ma-educate ng maayos, maiintindihan nila yung mekanismo ng sakit, and maiintindihan nila na merong way out for them to live a very normal life as long as sila is magamot. Kasi ang nagiging downside din, isa pang downside sa kanila, may mga pasyente kasing after maggamot at okay na sila, hinihinto nila yung gamot, which is hindi dapat yun ang mangyari. So, by simply making them aware, you are encouraging them to be very compliant with the medication para at least tuloy-tuloy din yung paggaling nila dun sa sakit.
How can schools po and universities po contribute to HIV awareness campaigns naman po?
So, for that one, I am highly advocating activities like this one. Kasi it is a means for educating people, most especially explaining yung mga gantong komplikadong sakit in the very layman term para at least naiintindihan ng lahat. So, yung mga gantong activities, kahit papaano, lalo pa at nanggagaling sa ating institusyon. So, para mo na ring tinanggal yung tabu na ito ay isang bagay na kailangan ikahiya. So, by simply having a platform of explaining things, sensitive things like this, I think malaking bagay siya para makita ng mga tao na, number one, maintindihan nila yung sakit. Pangalawa, maintindihan din nila na ang mga tao is open sa ganito para at least kapag kasi nakita nilang wala ng tabu or let's say walang any discrimination, maiengganyo din silang magpa-test on their own.
And we're now back on Lifeline. I hope you learn more about HIV and AIDS because we are now sustaining our momentum with a new segment in Lifeline called Quick Fix or Crisis, a way to dissect whether an online health hack clicks or just a glitch. So for our first statement, sexual abstinence is the best preventive measures for HIV and AIDS. Is this a quick fix or crisis?
For me, it's a quick fix.
Why po?
So technically, pag nag-abstain ka naman din doon, it is one of the means, since it's a bloodborne pathogen, it's one of the means for you to prevent the transmission. So, quick fix, but eventually sabi ko nga, monogamous pa din dapat ideally, and you have to know your rest din talaga.
Indeed po. And for our second statement naman po, condoms and lubricants can reduce HIV and AIDS transmission. Ito po ba ay quick fix or crisis?
Medyo half ako dito, but it's a semi-quick fix. So, in a way, it can protect kasi nga there is a barrier for the transmission of the secretions. However, you have to take into consideration the condom or yung mga protection, pwede siyang masira during the act or during the intercourse. So, it can still be a means for the secretions na maipasa sa iba.
Yes po. And for our third question po in connection to that, avoiding casual contact like hugging and sharing food to people with HIV and AIDS. Is this a quick fix or a crisis?
This is definitely a crisis. So, we don't agree with that. So, the only means for it to be transmitted to other people is through body secretions. Yung semen, yung vaginal secretions, breast milk, or perinatal transmission, those are the only means. Pero yung aakapin, hindi. Yung mag-share ng food, hindi. So, that will just contribute to the taboo.
Right po. Indeed. And for our fourth question po, is it quick fix or crisis? Supplements or miracle diets can cure HIV. Is this quick fix po or crisis?
This is definitely a crisis. Kasi number one, there is no cure for HIV. Once you had HIV, forever na yan sa'yo. Kailangan lang natin mapahina yung virus. And then, ang sagot dito or ang gamot na ginagamit dito is yung ARVs na tinatawag natin. Walang effect ang kahit na anong supplements for them.
The battle with HIV is not just medical, but also societal. The stigma and misinformation around HIV could do more damage than the virus itself. It's important to stay informed and make the right decisions when addressing this issue, which is why HIV awareness significantly helps in lessening the damage of the virus. While a cure for HIV and AIDS is still a long way to go, there are now medications that individuals can routinely take in order to live a normal and long life. We have to remember that a diagnosis should not define a person. I am your host, Angela Luna, for today's episode of Lifeline, where we improve our lives by feeding our minds.